Hello, this is Steve Lawler, President and CEO of the North Carolina Healthcare Association, and welcome to the NCHA. This is my 15th year in being part of the association. For the majority of my time, I was a member just like you that looked for ways to get involved, to really understand what the association is about, and then leverage this incredible power of the collective to help improve not only my organization, but to make healthcare better throughout the state. The North Carolina Healthcare Association just celebrated its 100th birthday several years ago. And we were founded by a group of physicians who wanted to come together to share best practices, share ideas, with the purpose of improving quality and patient safety throughout North Carolina. And over the past 100 years, we've been building on that to make quality, patient safety, patient experience better for all North Carolinians. One of the things I love about the association is this idea that it's the power of the collective. It's 130 members working together to make healthcare better for individuals and their communities. So I would encourage you, look for ways to be involved. The association is only as good as our members want it to be. And when our members are engaged, they're using our amazing portfolio of programs and services, ranging from IT support to quality and patient safety to PSO to strategic partners. Leverage those things to help you and your colleagues do your very best to deliver the best care and deliver the promise that you've made for people in your communities. You're going to have every opportunity to get together as part of groups. You're going to have every opportunity to be part of a conversation about what matters in healthcare in your community and throughout our state. And I just provide you an open invitation to help our association be great and help us work together to improve the status of care throughout all of North Carolina and to make sure that every North Carolinian, each person, regardless of where they are from or what they look like, have access to the very best. So I welcome you. I'm excited that you're part of this journey with us together, and I encourage you to be involved. Get engaged, use this as part of your network, and put your shoulder behind our work. So thank you.
Hello, my name is Cody Hand, the Senior Vice President of Advocacy, Policy, and Communications here at the North Carolina Healthcare Association. Our team represents you before Congress and the General Assembly in Raleigh on every issue that might come up. We are your advocates before policymakers. We work with your in-house government relations staff to make sure that your interests are represented both in Congress and at the General Assembly. On our advocacy team, we do have a grassroots director who works with you and with your staff to make sure that when issues arise at the General Assembly that need your attention, that they are deployed to call on your members of the House and the Senate. We also work with you to ensure that you have established relationship with those who make those decisions at the General Assembly. Our goal is that no bill impacting hospitals is passed without the General Assembly first calling you or hearing from you. We also work daily to make sure that you're apprised of any developments at the General Assembly to ensure that you know when it's time to speak up and when it's time not to speak up. We deploy a thorough process in defining and developing our positions, which are available at ncha.org. Those positions range anywhere from supporting Medicaid expansion to opposed changes to CON. All of those positions are developed in coordination with you, our members, so that nothing we say has not first been blessed by you. In our policy shop, we look 5 to 10 years down the road to see what needs to happen from a political and a policy perspective, such that you all can make changes needed to keep up with the changing times. Our policy process starts first with the government relations officers, the regional policy councils, and with our new Innovation Institute. The policy process then moves from the Regional Policy Council to our Policy Development Committee, who weighs and examines the data to ensure that our policies are not only sound and favorable to you all, but are data-driven. Those policies are then sent to the Board of Trustees, who have a thorough process to make sure that what they're doing is in the best interest of all of our members. We then guide them through that process to approval. Once approved, we deploy our policies through our various channels and work groups to make sure that you are not only aware of the policies, but are provided the tools needed to advocate for them both at the regulatory body and at the General Assembly. Finally, our communications team is a top-notch communications team, and I'm proud to say that we don't need an external communications firm because we have in-house talent, bar none. That communications team has launched an effort to claim the narrative, to make sure that anything impacting healthcare, we are driving the conversation, and we're representing you in the press and before the General Assembly in communications to make sure that your narrative is told and that your patients are best represented before the policymakers. All of this is done in coordination with hospitals and health systems to make sure that when somebody thinks about a hospital, it's a positive impression. We poll on a regular basis to make sure that the impressions are positive, to make sure that our members are best represented. And then we change and adjust our messaging to make sure it works for you. Our goal is to become an innovative and effective powerhouse that when folks think of the North Carolina Healthcare Association and the 130 members that we represent, not only are they positive thoughts, but they know that we are the trusted voice in healthcare. Thank you.
Hi, I'm Tatiana Kelly, the Vice President of Planning, Strategy, and Member Services. I'm here to tell you about educational opportunities within NCHA. Every year, we hold 2 annual membership conferences, one in the winter in February and one in the summer in July. In addition to these 2 annual conferences, we also hold educational opportunities throughout the year on topics such as regulatory, compliance, and financial issues facing healthcare. In addition, we often host conferences about specific issues facing healthcare today. We also offer a series of programs on diversity, inclusion, and equity, as well as resilience, which is one of the greatest challenges facing healthcare workers today. I'm here to tell you about the data programs for which NCHA is a steward. First, the North Carolina Hospital Emergency Surveillance System, or NCHES, is used by the state to monitor outbreaks within the state based on data that we send to state epidemiology, as well as for syndromic surveillance of emergency departments across North Carolina. In addition, NCHA is the steward of the patient data system, which is used to develop the state medical facilities plan as part of the Certificate of Need program. In addition, our members enjoy the benefits of this data for their own purposes in market analysis and future planning. Finally, NCHA provides additional data and analytics support to our members for their use in advocacy, financial planning, and quality improvement efforts. I'd like to provide information about how NCHA supports you in your emergency management operations. First, we work with the North Carolina Hospital Emergency Management Council, a consortium of emergency managers throughout North Carolina hospitals in tandem with state support. We also are the holders of the mutual aid agreements by which members can trade needed supplies and resources in times of emergency. We work closely with the state and local emergency management to assist you in times of distress and disaster. Thank you.
Hi, my name is Jeff Weger and I'm the CFO here at NCHA. Today I'm going to inform you as to our finance team and our role in serving the membership. Our role on our team is to inform you as to reimbursement changes and help you navigate those challenges. That includes making financial impact analyses so that you understand how these changes will impact your bottom line, and also help inform decision making and provide recommendations to you and your team. The last item that we do is we represent our members as far as their collective interests with various payers, whether it be governmental, commercial, or other, as to the collective position of our members. We engage with our members by way of various committee structures made up of our finance professionals throughout the state. Historically, we've had a couple of Medicaid committees, one being the Medical Technical Advisory Group, which deal with billing issues, and also the MRI Gap Technical Advisory Committee. The MRI Gap Technical Advisory Committee is charged with making policy recommendations on behalf of the field to ensure that Medicaid reimbursement is sufficient to continue to support the patient, and also to understand the various financing challenges for which hospitals contribute non-federal share. Another item that's going to be particularly important in the coming months as we transition to Medicaid managed care is going to be the role of the Managed Care Committee. Historically, that group has been charged with understanding commercial plan decisions and policy changes that have been made and making recommendations on behalf of the collective interest of the field. Going forward, that is going to include Medicaid managed care plans and the various policies that they may roll out that will affect your ability to deliver care to patients. On occasion, we'll also have an ad hoc committee based on the latest issue at hand. In 2020, we launched the COVID Committee, which was a group of financial professionals that reviewed various information that was issued by regulators and other entities, provided recommendations on behalf of the field, and then communicated how we thought various issues should be dealt with to our members. We communicate these recommendations in a handful of manners, one being the weekly CEO CFO memos distributed every Monday. We also have a monthly CFO call that allows staff to communicate the latest and greatest information and provide our members the opportunity to speak with their peers. If you have questions, please reach out to myself, Jeff Weger, our Financial Services Director, Anthony Acuniak, or our Financial Services Consultant, Ronnie Cook, if you have any questions. Thank you.
My name is Julia Wacker, and I'm the Senior Vice President of the North Carolina Healthcare Foundation. The foundation is the charitable nonprofit affiliate of NCHA. Our mission is to foster and accelerate the collective impact of hospitals, health systems, and community partners to improve the health of North Carolinians. We have an awesome team of 15 individuals that are fully dedicated to the work of the foundation. We have a number of funding partners that we work with. We're funded through state and federal grants, as well as private philanthropic partnerships. And then we also have corporate and individual donors that work with us as well. We really, in the foundation, we're really trying to leverage kind of our unique role as being at a state level organization that has ties to NCHA with the ability to make some real positive policy changes across the state. And so what we really try to do is match up or focus in on that sweet spot of where the funders are interested and what advances our mission and also what really supports members of the hospitals and health systems across North Carolina. And so we look for those promising practices across the state, trying to understand what's really improving community health, what's improving outcomes overall, and then working with state officials to remove any policy, regulatory, or legislative barriers that may be preventing what is the best practice from becoming the sustained practice. So we work in a number of areas, including rural health, behavioral health, mental health in both adults and children, substance use disorder, particularly opioid use disorder. We work in patient safety and quality improvement, and access to care, as well as chronic disease prevention. And then overarching and throughout all of that, our significant and primary focus is on achieving health equity in North Carolina.
Hello, my name is Jody Fleming, and I am Senior Vice President of NCHA Strategic Partners. We are the Shared Services Division of the North Carolina Healthcare Association. Part of what we do is partner with companies that bring value-added services to our member hospitals as well as other healthcare providers. What we're able to do is subsidize membership dues. If Strategic Partners was not in place, member dues would be 40% higher than what they are now. And we were actually able to hold membership dues down over a 2-year period because of the efforts at NCHA Strategic Partners. Also, what we're able to do is support advocacy efforts here at the association by largely funding the Claiming the Narrative campaign. We also help sustain reasonably priced member education events. So if Strategic Partners was not involved, member education programs would be $450 higher per person per event. We are also able to contribute to the general operating fund of NCHA each year. Last year, during the pandemic, we were able to contribute $1.4 million. And over the last 5 years, we've contributed $8 million to NCHA. Part of our strategic plan over the next 5 years is to create and improve a diverse portfolio of products and services. One of those initiatives we started last year during the pandemic, and the initiative is actually titled Made in North Carolina. We have a handful of suppliers here in the Tar Heel State that are able to manufacture and provide PPE to our providers. Also, we've increased the number of minority-owned partners that we're working with. We are specifically asking potential partners if they are minority-owned, woman-owned, and veteran-owned. NCHA Strategic Partners has been challenged to continue to grow our customer base. We have been developing collaborative partnerships with associations, alliances, and networks right here in the state and even outside of the state of North Carolina. One of those such relationships is Capstone Health Alliance in Asheville, North Carolina. And that partnership could potentially take us outside of the state into 23 other states. Strategic Partners will continue to be innovative and forward-thinking in our efforts to serve you, our members. Thank you.
Hi, I'm Cynthia Charles, Vice President for Communications and Public Relations at NCHA. Our role is to keep you informed about legislative issues and to provide resources like talking points to help you be effective in your communication about advocacy and other issues with your staff, patients, and community members. During legislative session, we'll keep you informed with weekly advocacy emails. You can subscribe to them at communications@ncha.org. As a member, you'll want to be familiar with our website, ncha.org. There you'll find information about priority legislative issues, as well as information about webinars, education programs, annual meetings and events. You'll also find a member directory and an NCHA staff directory. Another role of our communication team is to create public awareness about the value that you bring to your patients and communities. We do this through proactive social media activities, media relations, and special events like a virtual town hall series. You can find more information at ncha.org. You also might want to subscribe to NCHA publications. We do a daily news roundup about healthcare news in North Carolina and around the country. That's called NCHA Daily News Links. We also do a weekly summary about issues through a Sunday afternoon publication called Newsline. You can subscribe to both of those publications at communications@ncha.org. We'll look forward to getting to know you better, and if you ever have any questions, please reach out to us either by using the Contact Us form on our website or by sending a message to communications@ncha.org. Thank you.